Good afternoon, ladies and gentlemen. Good afternoon, all the scientists around. Good afternoon. I would like to present my article, which is about an overview of child malnutrition at Katima Mulilo Hospital, which is the city in the Zambezi region in Namibia. This is a short presentation. We want just to see how malnutrition is handled and if it's really an issue on public health point of view. So I will go to my introduction. Malnutrition is endemic in many developing countries in the world. Mostly the parts of the world which are highly affected with malnutrition are Southern Asia and Africa. In the African continent, the most affected areas are the Eastern, the Central, and the Western Africa. About severe malnutrition, severe acute malnutrition, we are talking here about thinness, because we know that when we talk about malnutrition, there is overweight and underweight. So we are not talking about obesity, but about thinness. And especially we'll talk about severe acute malnutrition, called also wasting. So severe acute malnutrition is fast, rapid wasting of the body weight, whereby the weight per height ratio is below -3 standard deviation, or where there is nutritional bilateral edema, or where also the mid-upper arm circumference is below 11 centimeters. So we went through the literature view and we noticed that there are vicious cycle of malnutrition and infection disease, whereby infection can worsen malnutrition and at the same time malnutrition can worsen the infection. And according to the article titled Levels of Trends and Malnutrition, which was done by UNICEF, WHO, and World Bank joint in 2012, Namibia was among the countries with severe malnutrition under 5 years, with a rate of between 5 and 9.9%. And Namibia is among the countries with underweight children under 5, with the rate between 10 and 19.9%. Namibia is also among the countries with stunting under 5 years rate that varies between 20 and 29%. So we continue with the literature review. We noticed that there is a poor clinical outcome and risk of death which is higher with HIV positive patients who are having malnutrition regarding micronutrients. And at the same time, it was noted that HIV exposure and infection exacerbate the issue of child malnutrition. Among case fatalities, according to UNICEF, when we have more than 20% of mortality among malnourished baby, that is unacceptable. When the fertility rate is between 11 and 20%, there is poor management of malnutrition. When there is 5 to 10% of mortality rate, we talk about moderate management. But when we have less than 5% of mortality rate, we can consider that the rate is good. So the next slide. Namibia is a lower middle income country which has 13 regions with a population of 2,113,077 inhabitants according to the 2011 census. Zambezi Region is one of the 13 regions of Namibia, has a population of 90,596 inhabitants. It is the second poorest region of Namibia after the Kavango region. So Zambezi Region has only one district hospital named Katima Mulilo Hospital. There are 25 clinics and 3 health centers in the region. In this research, our attention has been drawn to severe malnourished children admitted at Katima Mulilo Hospital in order to check whether what we have seen through the literature is really the same. Can we say that Namibia, as a lower middle income country, is doing well in terms of management of malnutrition? Do we have many or low cases of malnutrition? These are the questions we found on the list in the next slide. Does severe malnutrition a burden or common condition among children at Katima Mulilo? By extension, the whole Zambezi region. Does gender a risk factor or contributing factor of severe malnutrition? Can we say male are more affected by malnutrition than women? That's what we'll try to see also in this research. And the third question we try to find out is that, does HIV condition more predisposing factor to poor prognosis or bad outcome of severe malnutrition? The fourth question is, does infection or any other coexisting condition except HIV more present in severe malnutrition among children? Then the last question was, does severe malnutrition being costly to manage regarding the duration of stay in the hospital? So our research methodology, we tried to do a descriptive study. We went through the pediatric ward at Katima Mulilo Hospital, and we fetch all the cases of malnutrition starting from the 1st January to the 13th of August. So these results which are here are the result of patients admitted and treated or who died at Katima Mulilo Hospital, the only one hospital in Zambezi region. So we noticed that we had 225 days for this research, and the population which was found to be admitted during this period in the pediatric ward was 843. So among the 843, we had 76 children who were diagnosed severe malnourished. Among them, only 3, which is less than 5% of the population, were beyond 5 years. Other patients were the 73 remaining, they were less than 5 years. So we didn't separate the 3 just for the sake of having a clear view, and it doesn't really affect too much in our conclusion. So when we went through all this research, we found that mere 28% of severe malnourished children died during the period of study, which is more than 20%, which is beyond the acceptable one.
Yeah, Mr. Bitoma, sorry for interrupting. You have got 5 more minutes for your presentation. Please do fasten up your presentation.
All right. So we noted also that
You've got 5 more minutes for your
among the
presentation.
patients,
Yeah. Please do fasten.
okay, okay. Yes, among the patients who were admitted, 9% of the patients admitted were malnourished, which means is 1/11 malnourished babies, malnourished children. Gastroenteritis was the leader coexisting infection in severe malnutrition. And we noted that the male children are prone to malnutrition than female. And the average stay at the hospital was 10 days, 1 hour and 8 minutes. And the maximum days was 27 days. So these are the charts which explain the number of children who died of severe malnutrition, the number of children who remain alive during this study with malnutrition. We checked also the number of children with gender, according to the gender, male and female. We checked also the number of children according to the gender, those who didn't die. And we checked also the HIV status. We noted that most of our patients who were in this study were not having a known status, but those who were known, the HIV status was known, more was non-negative HIV status, and just few were positive. So our conclusion is that Katima Mulilo district has a mortality rate which is not acceptable, 27.63 of severe malnutrition, children who died. And we noticed that male children are more fragile to malnutrition. We didn't notice really a big difference between those who are HIV positive and HIV negative, because the number of those who died were more HIV negative patients than those who were HIV positive. And 50% of patients with malnutrition were suffering also of gastroenteritis. Then our conclusion is that all the means to prevent severe malnutrition to occur has to be taken and implemented. Male children are more vulnerable than female. The HIV infection as well as severe malnutrition needs to have more awareness in order to reduce the risk of HIV and the risk of severe malnutrition. Prevention and treatment of other coexisting conditions such as gastroenteritis, pulmonary TB, will help also to treat better severe malnutrition. This is, in short, what I can say. Thank you very much.